get right started right away. I'm gonna share my screen. Start out just going straight for the surveillance report, kind of walk you through what's in the surveillance report uh, this week. Before we do that, I just kind of want to make sure that we throw out a little bit of a word of caution because this period included Thanksgiving. We need to be pretty careful about drawing too many presumptions or assumptions based on this data. It's definitely part of the story, but I really want to see what happens in the weeks ahead. And for instance, this first data point related to that rolling 7-day average, the number of cases, that trend line is what we want to see. But we have to take into consideration Thanksgiving the day after. There were virtually no tests that happened. People were, which is a good thing. People were home. And so that those numbers came down. When you take those days out, we're still seeing somewhat of a drop, but our average number of cases was about 100 per day once you take out Thanksgiving and Thanksgiving Day, if you calculated this. So it's good to see it not climbing anymore. But we need to really think about the holiday and be careful about making too big of a leap of assumption on what this all means. But it is encouraging. You see that our percent positive, which really takes into account how many tests you're doing, what percentage of tests you're seeing, has come down a bit. But again, what we know is what's happening, at least to some extent. We can't tell exactly how much, but what was happening to some extent during the Thanksgiving week is there were a significant number of people who were seeking testing because they wanted to travel. And so they may have not had symptoms. We may have had a larger, sort of pool of people going to get tested than they otherwise might have. And that may have been depressing our percent positive because they weren't symptomatic and they weren't exposed. Nonetheless, we'd rather see it go in this direction. I just, again, caveat, Thanksgiving week is a pretty outlier week in the grand scheme of things. So we need to be careful about making too great of assumptions on it. But, being above 20% is not even close to where we want to be. We really want it to be below 10% or even below 5% ideally. So while we're coming closer to that, that's a good thing. I want to see what happens over the course of the next few weeks as we get into more non-holiday weeks. And then we'll have the same problem when Christmas and New Year's hit. One thing is definitely positive is that the testing turnaround has gotten better. That's probably not shocking with the fewer number of people seeking testing, but we've also seen capacity work go on to expand capacity, and so we're seeing the median number of days from specimen collection to report to public health coming back down to 2 days. And then again, you're seeing, this is what we want to see. We want to see that 0 and 1 day. We want to see those first bars as high as possible to get those numbers back. 0 days, those are probably antigen tests that are being done in 30 minutes or so. But to see that, and if you recall last week when we were looking at this, the most common number of days was 5 days. So this is a sign that our testing system is, the Thanksgiving probably helped our testing system recover partly because there's fewer people seeking testing. We continue, that's also helped us. Again, the slide doesn't change that much from week to week, but we continue to be it's helped us recover at the health department a little bit. We're still getting a pretty impressive number of cases, but we've hired up and we feel a little bit more orderly in the way that we're able to get to those cases and to identify higher risk cases. You can see the symptom onset date. Again, the caution I always give, that blue shaded area is incomplete data. And you can see it seems to be coming down a bit, but again, we need to see what happens in the rest of December and into January before we draw too broad conclusions. Age category looks a lot like it has in the past. That 20 to 29 age group continues to sort of outpace the number of cases that we're seeing in other age groups. And then as you get older, you have fewer and fewer cases all the way down to the 90s. So that's nothing shocking. MSU data, as you might expect, the number of cases is down significantly with the with Thanksgiving break and the students, the on-campus students in general going home. See pretty big drops, which is helping to explain the drop in the overall testing numbers, and just in general. And then we have a snapshot of the active cases we have at various elementary schools or high schools, middle schools, and elementary schools. And then the link here will take you to the DPHHS site, will give you the cumulative number of cases. We're trying to give you something different here, probably a little bit more immediate in terms of the active number of cases we have associated with each school. And then, I think maybe the most promising thing that we're seeing is we're seeing the number of people hospitalized ever so slightly edge downward. I think we were down under 20 yesterday or today. That probably is the truest indicator of anything, is how many people we end up with in the hospital, and seeing that number stop climbing for at least a period of time. Those sorts of numbers don't necessarily take a break for Thanksgiving. When somebody gets that sick, they tend to need the hospital, whether it's Thanksgiving or not. So that is somewhat encouraging. What I would also note, though, if you look at the wastewater data, the most recent wastewater data that we have on the website for the city of Bozeman, we actually saw an uptick in the level of virus detected during the most recent. So, if that had continued to come down, that may have validated part of this. So it really is a somewhat uncertain overall picture that we're seeing because of the noise in the data related to Thanksgiving, related to MSU going home, just related to this last week being kind of a strange week overall because of the holiday. So I'm happy to take questions. I'm sure you've got a little bit. It's been an eventful couple of days, both in terms of CDC guidance, in terms of vaccine. I'm just going to let you shoot questions at me, and I'm going to do my best to answer them.
Matt, before we get to questions, we're gonna general questions. We're gonna have Darcel.
Thank you. Would you mind introducing her? I'm so sorry, Darcel. I just went on cruise control and didn't do. Would you mind introducing her, Whitney?
Yeah, not at all. Everyone, this is Darcel Vaughn. She's the administrator of the Gallatin Rest Home, and she was here to kind of give an update on the COVID situation at the rest home. And also, when she's done speaking, then we'll open it up to questions to both her and Matt. So go ahead, Darcel.
Awesome. Thanks, Whitney. So, hi, everybody. I guess just to let you know a little bit of background on what's been going on with the Gallatin Rest Home. So many of you know we locked down March 13th. Sorry. Holy cow. Sorry, I wasn't expecting it to be quite this soon. So right now we are down to 34 residents. That's because, not in a bad way, that's because our rehab, which was completely full when we locked down on the 18th of March or 13th of March, the majority of those people have gotten better and been able to go home. We were able to keep COVID out of the building until our first, positive staff case, which happened on the 26th of October. Our first resident case didn't happen until the 2nd of November. One of the things that we did that I don't believe other facilities have either been able to do, we've been fortunate in the fact that we're a skilled facility. We've received some testing supplies from the federal government, and then thanks to COVID money, we've been able to purchase additional testing supplies. So since this has happened, we have started testing all of our staff at the beginning of every shift. Besides doing the screening for the temperatures and symptoms, the county is awesome in that our staff knows that we don't want them here if they're sick. And there's been emergency funds to be able to pay staff to stay home. which I think has helped us out immensely. I know that our contractors that we deal with on a regular basis do not have that ability, or I'm going to say they just don't have that ability necessarily to do that. So we're very fortunate with the county that they want to keep us as safe as we can possibly be. I'm sure I've heard from quite a few people as far as the fact that you guys probably want total numbers. We've had a total of 23 cases. 15 of those have been staff and 8 of those have been residents. We are still in quarantine. We currently only have 1 resident who is still considered a quarantine period. And our quarantine period is different than what it is for the public. So the public is I should say isolating, let me use the proper verbiage. If they test positive, I know that the public has been isolating for 10 days. Because of the fact that they're in a nursing home to start with, our residents with their comorbidities, we decided to make them, have them isolate for 15 days to be on the safe side. And so we have the 1 resident actually who should come off on Tuesday, the 8th. So we're still in quarantine and we'll probably remain in quarantine based on current regulations till at least the 22nd, just because the goal is no positive cases for 14 days after your last resident comes off of isolation. So that's where we're at. We've been fortunate in the fact that we've had quite a few that have been asymptomatic, which is very fortunate considering the comorbidities that they're in a long-term care for to start with. We did have 1 resident who needed to go to the hospital at the very beginning and ultimately refused some treatment. They were on like day 8 of isolation, refused treatment, and due to other situations went home on hospice and ultimately passed. Otherwise, though, we've been doing well, other than I have to say the psychosocial part of this whole disease process. So our residents have, with the lockdown, it's our staff basically that are doing the one-to-one visits. We're doing the Zoom visits with families. When we're able, we do window visits. But you have to think of what it would be like to not be able to hug or kiss your husband, your wife, your daughter, your son for 9 months. And this is taking a toll. My staff has been absolutely awesome. We're very fortunate, but it's not the same. It's really not the same. And so I just want to ask and make sure it gets out there. And I know everyone's doing their messages, but I know that there are those people that don't believe this is an issue. They don't believe that they should be told by the government what they should or shouldn't be doing. I understand that. But if you can't wear a mask and keep your social distance and do the right thing for yourself, could you please do it for our elderly that are in facilities that are locked down? And I mean, this could be the last Christmas for quite a few of our residents. We have lost some residents, not due to COVID, but we have lost some residents lately due to their comorbidities. And they didn't have that opportunity to say goodbye to family and vice versa. And if we can do whatever we can, wouldn't we, from a humanitarian standpoint, do what we can to get us as close back to normal as we can so that these residents, patients, however you want to look at it, can actually spend time with their families and enjoy their last days. I think we just have to look at it not from a selfish standpoint, but look at it in terms of other people and what their needs are. And so I just ask everybody, I know this is hard. I know that we're all tired. Believe me, my staff is tired. the overtime that they've worked, the fact that they love their residents and they're doing everything they can to stay as safe as they can. We were all hit hard when it came into our facility, but we also knew that with the community spread, it was bound to happen. We just have to ask everyone to just quit making this political, quit making this is about humanity, and it is what it is. And let's just do what we can to help each other out and get past all this. I think that's all I've got, unless everyone has any questions.
Thank you, Darcel. I have some general numbers. I just want to say I appreciate you being available, because I think it's important for folks to hear from the people who are really on the front lines.
Yeah.
Since the beginning of March, we have had a total of 158 COVID-19 cases among residents in long-term care facilities. We've had another 136 cases among staff in those facilities, and that would include the skilled nursing facilities like the one Darcel runs, as well as what's more numerous are the assisted living facilities. So that's 158 residents and 136 staff. You know, of the 20 facilities, roughly 20 facilities, I think that was the number we counted today, we've got 16 of them have had at least one case among residents or staff. It really is unusual to not have one that's had the experience. And we've had 17 deaths associated with long-term care facilities. So, you know, in general, it's a pretty significant, very early on in the pandemic, we added staff, the health department added staff to be able to support the people who are doing this really hard work. And I can tell you on a day-to-day basis, my staff reports to me that the people doing this work, I mean, the heart and the emotion that you're seeing from Darcel today is not unusual. They are absolutely committed to the residents they serve. And this is tough. And I think what has become even tougher is as our case numbers have gone up in the community. You know, it used to be really unusual for us at the health department. When we got one case in a facility, and Darcel can attest to this, we didn't have a case at the rest home for a long period of time. And that was due to the hard work of the people there and frankly, Darcel's leadership and the people who work there and the partnership that they had with us. But as the case numbers sort of crescendoed here in the county, it became much more difficult because the staff who works in these facilities, they lead a life. They are out in the community. It's not that they're doing anything wrong, but they're out in the community and they're leading a life, and they have to shop, and they have to go, you know, their kids go to school, and they're the same as you and I. They don't live at the facility. They're in the community. And as the case numbers rise in the community, it just became harder and harder and harder for us to keep COVID out of those long-term care facilities. And over the last several weeks, we've gotten to the point where just about every one of them has been dealing with this in different ways and just fighting like crazy to keep it out. And then once it comes in, fighting like crazy to keep it contained. And I just want to call out the amazing work that's been happening from those folks. I would say, you know, it really is also important that as we recognize that we honor what they're doing, and we try to honor what they're doing by doing the things that need to happen to reduce overall spread in the community, because that makes Darcel's job easier. If we can stay away from crowds and crowded settings, if we can wear face coverings when we are in public, stay home when we're sick, washing our hands thoroughly. And I know it's hard, but it's the holidays, and it means making decisions sometimes to skip those holiday events. You know, I wish we could have Christmas stroll the way we normally do, but that's not really in the cards right now. And so I would urge everyone to find imaginative ways to celebrate the holidays in ways that keep people safe and in small groups. You know, Montanans can do this. Montanans can. We can do this. but we need to work together, and we need to really make sure that we're taking care of one another and thinking about one another as we go through this. So with that, I would encourage any questions for me or Darcel.
Matt, Annie Johnson with KBZK. I have a
Hi,
quick.
Annie.
Hey, Matt. So I don't know if you saw Governor Bullock's press conference Wednesday, where he talked about vaccines and distributions. Do you know what I'm talking about?
I know the vaccine's coming.
Yes, he said specifically Montana would receive some as early as December 15th. What information, or do you have any information about Gallatin County receiving them specifically?
No, I don't have any numbers. I have talked to the Bozeman Health today. I think the hospitals and the care facilities are getting a little bit more specific numbers, because I have a feeling that those initial doses are really going to be targeted on those long-term care facilities, on hospitals, frontline healthcare providers, residents and staff in homes of places like where Darcel works. So I think that's what's happening. But honestly, this is all happening so quickly that we don't have a lot of information. What I can tell you is we're getting ready. We practice every year. We practice what's called a points of dispensing exercise, which is a way that we can operationalize a way to give shots or give antibiotics, as the case may be, depending on what the need is. And so we're working with Gallatin County Emergency Management. We're communicating with Bozeman Health. We've reached out to first responder agencies, and we're thinking through ways that we might be able to use the fire stations and the paramedics to operationalize this. What I would stress to everybody, it's going to be a long process, and it's going to require some patience and some grace. Remember, the healthcare system and the public health system that we're relying on to get this vaccine out these are the same people who had been doing contact tracing for the last 9 months. They're tired. We're going to do it, and we're going to throw everything we have at it, and we're going to do our damnedest to get that vaccine out as rapidly and as safely as we can. But remember, it's 2 doses. It's multiple different kinds of vaccine. It's a big lift, and we're getting ready for it. But the information that we have right now isn't really enough. I have not seen numbers for Gallatin County at this point in time.
Gotcha, Matt. And I have one more question. But can you give a guesstimate? I know they said healthcare workers probably first, and then those in those long-term care facilities. So for, I guess, people who don't fit in either of those categories, do you think it would be like weeks, months, a year?
I don't think it'll be a year. I think everything that I've read, and you can read the same things I'm reading from Dr. Fauci, from the vaccine companies coming out of the federal government. The intention is to identify and get to those really high sensitivity occupations and high sensitivity populations first. And by the time we get to spring and summer, we'll have a vaccine that's more available for everybody. And so I'm hopeful. I don't have a lot of inside information, I'll warn you, but I am hopeful by the time we get to spring and certainly early summer that we'll be being able to offer a vaccine to anybody who wants it at that point in time. Do I know that for a fact? No. Has anybody told me that directly? No. It's just based on what I'm hearing and what I'm reading, and I'm trying to read as much as I can right now.
Gotcha. Thanks, Matt.
Yeah. Other questions?
Hey, Emma with NBC.
Hi, Emma.
So I know you touched on it a little bit when we were going through the surveillance reports, that some of these numbers may be off a little bit just from the holiday last week, but is the dip we're seeing in both the number of cases reported? I know we had a lot overnight today, but I know at the start of the week it was lower than we've seen before, new cases per day. Could this possibly still be catch up from the holidays, or is it just because people weren't really reporting or going in and they were staying home over the holidays?
Can you ask that again? I want to make sure I'm understanding your question.
Sorry. Yeah, I was just wondering if the dip in numbers that we've seen this week, if that could be due still to catch up from Thanksgiving, or could it be due to, like you said, people staying home and maybe not going and getting tested and reporting that they have symptoms?
I think you're seeing a combination of of the impact on the system of the holiday and MSU. Like MSU's testing numbers, when you look at the numbers on the surveillance report, as you would expect, have gone down dramatically. So our overall testing numbers have gone down. Part of that is because people left town. A lot of MSU students went home for the holiday. Part of that is people just some of the test sites shut down. The labs weren't running for a couple of days. I think that's part of it. I'm hopeful that when we come through this, we'll see the overall numbers continue to kind of stabilize in a way where we can have a little bit more confidence that people are, what may also be happening is people are taking this more seriously. And in the last several weeks, we've started to see deaths with more regularity. Our hospitalization numbers ticked up. And what our experience has been is when that happens, it tends to get people's attention. The other thing I would say is we put in place some additional restrictions related to bar time, related to density of people in gyms, restaurants, and bars, those kinds of things that I think are probably having a positive impact. And I think all those things together probably are what's painting our picture right now. But we're going to know more in the next couple of weeks. That week before Christmas, I think we're going to get a much better sense of like whether we will be able to untangle some of this and really understand if this is something that's just a side effect of Thanksgiving and we're going to go right back to where we were before, or if we've been successful in at least finding a plateau so we're not climbing anymore.
Great. And so other question, I know you mentioned with the first batch of vaccines coming on December 15th, obviously your department is getting prepared for that. But just in general, are there any other extra measures that you guys are trying to take or trying to prepare for going into Christmas and the rest of these winter holidays?
Well, I mean, it's a pretty complicated time right now. As I mentioned, the people who are going to be delivering that vaccine, both in healthcare and in public health, are a lot of the same people who are doing contact tracing and caring for people with COVID right now. As we're doing that, we're preparing for the vaccine, and the CDC guidance change on quarantine length of time is pretty significant, and going from 14 days to 10 days. And so one of the things that we're spending a lot of time with right now is operationalizing that. We just learned about that yesterday along with everybody else. We didn't really have much of a heads up from the CDC. And so that's the other thing we're working on pretty significantly today. And we're also looking on the communication side of things. We're looking for new and kind of imaginative ways to communicate, hopefully with a positive force, kind of come out and build agency in people to make them feel like they have some control over this. So really all of those areas we're working on pretty intensely right now. Other questions?
Hi, Nora Shelley with the Bozeman Daily Chronicle here. I'm wondering if there were to be any Thanksgiving-related surge in cases from gatherings or whatever, would we have seen those already in the numbers, do you think, or is that something we would look for next week, maybe?
Probably next week and maybe even the week after. The incubation period of the disease is between 2 and 14 days. We tend, you can see with the CDC guidance, you're tending to see the disease crop up within 10 days. So I think we'll see next week will be pretty interesting to see what our numbers do, what our testing numbers do, how many cases we get.
Okay. And I was also wondering, I'm not sure if you saw, but yesterday there were a few people out on Main Street around like 5, 6 o'clock with signs in your support. And I was just wondering if you had anything to say about that. Oh, I think you might be muted.
You're having microphone trouble again, Matt.
Can you hear me? All right, good. I think it's when I go, can you hear me now? Is that a yes? Okay. Do I have anything to say about that? The past 8 days have been pretty difficult for me and my family. And the well-wishers last night, it was unexpected and humbling and encouraging. And I want to thank the people who turned out. That was really nice. It was a nice way to end the day. And most importantly, for my wife and kids who I signed up for this in some ways, they didn't. And so that shows support, encouraging us to keep our chins up. It really is helpful. And it's especially helpful to my kids. So even though they weren't there to see it, I didn't know that was happening. It just kind of happened. I was kind of tricked into it a little bit. But I also want to say it's a little bit embarrassing for me. And what I mean by that is I'm just a small part of the overall effort. You all see me. My job happens to be the guy running his mouth about this. But my team, everything that I have accomplished and we have accomplished is about the people who are in this building with me and at the Emergency Operations Center at Bozeman Health. Every day I work with dozens of committed and trained professionals, nurses, registered sanitarians, admin folks, people at the hospital, people at emergency services who are just working their hearts out for this community. And so it feels a little awkward for me to be the focus because I know every day how much work they're putting into it. And I really want them to feel that. That was a pretty good feeling last night. But if I could do anything, it would be to make sure that people at the county, Darcel's people would feel the same thing. And that's the other reason I'm a little embarrassed because, a lot of the people who are reaching out are my heroes. Darcel and her team, teachers, my kids' teachers were reaching out and thanking me. And I felt like saying, are you kidding? I'm doing what I'm doing, but teachers every day going into classrooms and some of them with underlying health conditions and standing in front of 20, 25 noses and mouths, that's pretty heroic. And, I just can't express enough gratitude for the teachers and educators, for the people that are working in the clinics who are caring for COVID positive people in intensive care, and the med-surg floor at the hospital to get sort of to hear their appreciation. I just want to say thank you to them. I felt humbled by it, and to have teachers and healthcare providers reach out like that was pretty special. But I also, I had a conversation with a teacher who I really respect a great deal the other day, and she said, I appreciate the kind words. I appreciate the thanks. She said, I don't really want to be regarded as a hero. What I really want is for people to take this seriously. And I think what we can do to really pay honor to that work that those people are doing is to do the things that it's going to require for us to keep people out of the hospital, to keep cases out of the nursing home. And that's staying out of crowds, staying out of crowded settings, wearing those darn face coverings, even though they're annoying, especially in those indoor settings, staying home when you're sick, washing your hands thoroughly. And again, I know I mentioned this, but it's the holidays. I know it's hard. There's 100 parties. There's hopefully not 100, but there's this impulse, you're being invited. Please try to make decisions to avoid that contact with people where you can. Find new and imaginative ways to keep the virus at bay, stay small, stay in small groups, find ways to visit with people online, keep it safe. Montanans can do this. Montanans can. We just got to take care of one another, and we got to do all the things that way to limit that spread. And that, I know that that recognition was really nice, but just speaking for myself and speaking for everybody else, what I would really request is everybody really think about ways that they individually can help us limit the spread of this disease, because that's going to help people like Darcel really protect the people that she's serving every day. Other questions?
Matt, this is Kevin Trevelyan from Yellowstone Public Radio. Thanks for holding this call.
Yeah.
You mentioned the new CDC quarantine guidelines earlier. I've seen mixed responses from different county health departments on those. Do you know at this point whether Gallatin County is urging residents to follow them, and are there any worries about confusion among residents with the new messaging?
Yeah, it's going to be confusing, and we're worried about that, but we're working hard. We're trying to update our website. We will be following them. But it's going to take a little bit of time. What we're doing right now is we're implementing the 10-day. Remember, it's not just 10 days. It's 10 days without symptoms. If you get to the 10-day mark without symptoms, there's a little bit of a transition period there. The really tougher part of it is there's another part of it that says 7 days if you can get a test. And it says, if you read the CDC guidance closely, it says, when diagnostic testing resources are sufficient and available, you can do these things. And I have a real concern of the impact of this policy on our testing system as a whole. I think it's going to draw and drive more people to want to get that test that can get out of quarantine. That's understandable. I think there's a couple problems with that. One is the PCR testing that we're using is limited. We've seen it can get overwhelmed. And if we have everybody who's in quarantine going to get their test, I'm really worried that that could happen. There are some other options that are out there. Some of the antigen testing, some of the testing out there that is available that is a little bit faster. You can get results in a day or so. Where people can get those tests and where we have testing resources that are sufficient and available, we'll also be working with people on the 7-day, but that's going to take a little bit more time because remember, you got to test negative within a particular period of time and you have to be symptom free. The simpler thing is to think about it going from 14 days to 10 days. We're implementing that immediately. And we're going to be working with people on that. And we're updating our literature and we're updating our website and those sorts of things. I just would ask for patience on the 7-day issue because that's going to be a little bit harder. Now, there are some organizations that have the capacity to do testing where that might be a little bit easier. So if you have got the ability, for instance, at the law and justice, at the jail to do testing, if we have a sheriff's deputy who's in quarantine that we need to get tested, we have the capacity to do that. They're a first responder, we can get that testing done. The schools are getting some of the more rapid test kits. So they're going to be able to do some testing with their staff, but it's going to be a challenge for the general public because those testing resources that we have are finite. We're going to have to be really careful that we don't overwhelm those because we need them for people who are symptomatic and people who are exposed.
And a follow-up question for you on the vaccine front. Can you talk about what kind of ultra cold storage capabilities exist in Gallatin County and where?
I know that we have some at MSU, and MSU has been looking at and kind of inventorying that. I haven't figured out if they've got any at the hospital at this point in time. We're exploring it, but we also know with the Pfizer vaccine, there's the capability to keep it cold without having the freezer, that you can use granulated dry ice, and it takes really careful a process to make sure that you're changing out that dry ice. You're not opening up those coolers too often. So we have some options there. We're looking into acquiring it ourselves, but it's kind of hard because we don't know what vaccine we're getting. We don't know how much. We don't know if we're going to have enough to store, frankly. We want to get it, once it comes in, we want to be able to administer it. So we don't have it at the health department at this point in time, but it is our understanding that the Pfizer vaccine, you don't necessarily have to have an 80 below zero freezer to store it, but you do have to have access to dry ice, and you do have to have processes in place to make sure that dry ice is changed out. And then we're talking to MSU and we're talking to the hospital as well.
Thanks.
Yeah. But you're hitting on, it's going to be a challenge. You're hitting on one challenge is the storage. Everybody needs 2 doses, at least with the Pfizer and the Moderna vaccine. And you can't mix and match. You start with Pfizer, you got to continue. You got to get your second dose be the Pfizer vaccine, and the same with Moderna. So that's going to be a process, and it's going to be, I'm sure it'll be confusing and at times frustrating, but we're putting a lot of resources into it. We're continuing to hire people, and we've really engaged our emergency management staff to help us out with it. So it's a community effort. It's not just going to be the health department doing it. Other questions? Well, you're a quiet group today. No other questions? Okay, I appreciate all your time, and I hope you all have a good weekend. Darcel, did you have anything you wanted to say?
Guess I have to unmute first. No, I'm good. Thanks everybody for dealing with the emotional aspect of this, but certainly hoping we can get through this.
Thank you all. Thanks, Darcel. Take care.
Thank you.
Thanks, Matt.